Good morning, you are very welcome along to Ireland AM. It is Thursday the 18th of April and we are coming to you live from Limerick City this morning.
It's lovely to be here. He's already tried to take down a Munster flag, but we're here to highlight something very important. It's Ireland's healthcare system, particularly at University Hospital Limerick. The overcrowding, trolley figures and the lengthy waits.
Yes, throughout the morning we are going to be speaking to those working within the hospital, those who have been affected by the crisis and those campaigning for change.
Absolutely, and we'd love to hear from you this morning, as always, on anything related to health in this country, from our hospitals to our GP service. Particularly if you're involved with UHL, you can get in touch with us. It's 0896 111 111, or you can email us on irelandam@virginmedia.ie for those lengthy ones.
Yeah,
you know that there are
the big grant.
Oh yeah,
you've been banking that one for a while.
We're waiting for you.
Yes, we're going to be back here very shortly to chat with some of the medical team who are working on the ground in University Hospital Limerick. But for now, let's get back to studio where Gràinne and Alan are keeping the studio warm. Morning, guys.
Morning, guys.
Morning,
how's it down there?
Very nice.
Beautiful.
Actually, yeah. All this
Looks
talk
lovely.
of Limerick from Muireann. Who would have thought?
You are such a pup.
Thanks, guys. Thank you.
We're going to be taking a look at the stories making the headlines at 7:35.
And for something then completely different, we're dissecting the Netflix thriller that set the internet alight. Our movie man Brian Lloyd is here reviewing Baby Reindeer. Have you heard about this?
No.
Oh, listen, it's really... Anyway, we'll be talking about it a little later on.
Can't wait to hear more. And we've got Swiftie style on the catwalk. We're taking inspiration from megastar Taylor Swift's fashion eras ahead of her latest album drop.
Now, Derek's on weather duties back here at base this morning. How's it looking, Derek?
I am indeed, Al and Gràinne. I can't get over how chilly it is out there this morning. We're seeing some mist and fog to kickstart Thursday. Elsewhere, we're seeing plenty of showers out there today. Heavy once again through parts of the north. And it looks like we're going to have to hold on until Saturday and Sunday to roll out the barbecues. 2 days of sunshine on the way.
Planning
At
it
least that's
already.
something.
Yes, absolutely. Thanks, Derek. Time now to take a look at the morning's papers, starting with the Irish Times. Its headline, airlines may face higher fines under immigration reforms. Airlines could face higher fines and be subject to tougher legal obligations to check the documents of passengers flying into Ireland under proposed new immigration reforms.
House prices rise 6% as buyers bet that the rates have peaked. That's the front page of the Irish Independent. The possibility that interest rates have peaked and will fall have been cited for one reason for the pace of the property prices picking up.
The Examiner leads with toxic content fed to teenage boys. Children are being directed to dangerous, toxic online content by social media company algorithms within minutes of use, sparking calls for urgent action.
Charity to hospital, give us back our property. That's the top story of the Daily Mail. It reports a legal battle is being waged against Beaumont Hospital over its failure to hand back a property loaned to it by the Irish Kidney Association during the pandemic.
The Mirror goes with Gangsters Paradise Lost. Gangster David Waldron and his wife must hand over assets worth €3 million, including a luxury home, after losing a battle with the Criminal Assets Bureau.
The Star also leads with that story in its headline, Where Did Mall Go Wrong?
The Sun leads with praying for justice. The Stardust inquest jury's long-awaited verdicts will be delivered at 2 p.m. today. The panel yesterday revealed they had reached majority verdicts. This comes almost a year after the inquests.
The Herald goes with a sue you later alligator. A couple have launched high court proceedings in a dispute over the ownership of a garage where they keep exotic pets, including scorpions, chameleons, and an alligator. There you go.
Now.
As you do.
Yeah, as you do.
As you do.
As you do. Up next, we're heading back to Tommy Muireann, who are in Limerick City this morning.
See you back here in a few minutes.
Good morning. All morning we are dealing with issues in Irish healthcare, particularly in University Hospital Limerick, where problems of overcrowding, long wait times and a lack of trolleys remain persistent.
We are live from Limerick and we're joined now by two of the hospital's staff members dealing with these issues, emergency consultant Alan Watts and Anne Noonan, senior staff nurse and spokesperson for the Irish Nurses and Midwives organisation. Good morning to you both. We appreciate you both being here. And first of all, you have worked worked in UHL for 40 years in various guises. I know you work in theatre now, but obviously being the rep for the INMO, there must be an awful lot of people coming to you with the issues that they see every single day. So what are people telling you on the ground?
Good morning. I suppose the issues mainly that people are coming to me with are stress due to understaffing. We have 200 nursing deficits at least in our hospital, and we've been told at a meeting in the last few weeks that these will be worse next month when we get our figures. So that's 200 nursing deficits for the funded beds in our hospital.
But since 2020, Limerick UHL has got an extra 1,000 staff and the budget has gone up by 45%. So what is going on?
Well, I grant that has actually happened, and thankfully in nursing now we have promotional posts, but I'm talking about staff nurses and all of the nursing profession. For the funded beds, there's 200 deficits. Now, our minister did promise us when he came 2 weeks ago that he would provide safe staffing to each ward. That was a commitment that he made. And there is safe staffing funded for a certain number of wards in our hospital. However, due to the deficits, that if you have safe staffing on your ward today and the ward next to you or another ward has a deficit, nurses will be taken from that ward to fill the deficits in the other ward. So basically we do not have safe staffing on any ward due to the fact of our deficits.
OK, so Stephen Donnelly was here 2 weeks ago.
Yeah.
He made a range of promises, from community beds in Nina, Clare, 71 new beds in UHL, safe staffing, which again, as you say, can he promise that whenever you don't have the numbers? Alan, let's come to you. You're an emergency consultant in University Hospital Limerick right here. Can you paint a picture of what it is like on a daily basis?
Sure. So the emergency department at UHL is the busiest in the country. So we have the highest number of attendances, and that was borne out in 2023 when we had over 81,000 attendances. And even in the first quarter of 2024, we've seen an increase in attendances, and now we're seeing about 223 people per day on average. But it's really the overcrowding that is the issue. And it's the overcrowding where individuals, patients, are waiting potentially for long periods of time, waiting for a bed in the hospital, with all the issues of dignity and privacy that go along with those issues. And you know, it's really outrageous, and it's not the kind of care that we would want to deliver in 2024. And
for you, like as a consultant for you, when you're trying to do your best, but you're walking past over 100 people lying up on trolleys in the corridors, probably all trying to get your attention, but you have to move on and look at whoever's on your list. How difficult is it for you to do your job effectively?
Well, it's difficult for our staff and for the nursing staff to do their jobs, but I think it's important to make a distinction between the number of attendances of people who had come to the emergency department and then what overcrowding actually means. So yes, like I said, we're the busiest emergency department in the country. A lot of people come to the emergency department. But of those people who attend the emergency department, we probably discharge somewhere between 70 and 75%, and that's true nationally.
So in relation to that, right, so you were saying they're coming to the ED and they're not being admitted, they don't have to, so we can let them go. Stephen Donnelly, he promised, and you were at this meeting that he chaired down here on April the 4th, to tackle overcrowding in the emergency department. He said that they're going to provide GP and advanced nurse practitioner on the door services. Is that going to help? Because obviously people can't get an appointment in the Midwest region to go to their GP, so they're presenting at the emergency department instead.
Right.
Will that help? So,
if I can just come back to that in one moment, the number of people who get discharged from the emergency department is about 70 to 75%. So the rest then are referred to a specialty, whether that's medicine or surgery, for admission. And it's those patients who are then waiting on a trolley for a bed because the primary issue there is capacity. It's not enough beds in the system. And this is true in University Hospital Limerick, but it's also true in other places all around the country that have the same issues. In relation to your question, a co-located GP service has started at UHL last week on Tuesday. They're there from 12 to 10. They have a nurse and a physician to potentially review presentations that would be suitable for a GP. But it's still in its infancy, so we don't know what impact it will have.
And Muireann mentioned a minute ago the budget going into University Hospital Limerick has gone up by 45% in 4 years. Like, that's an astronomical amount of money. I think it's up to 383 million. But you're still saying you don't have enough staff. Do you question where is the money? And do you feel that you're being listened to from the management when you're looking for another 500 nurses? This money is coming in, but you're not seeing it on the ground.
Definitely there is an element of that. However, there is a deficit of nurses worldwide, and our hospital would be on its knees if it were not for our international nurses. I have to say, though, the moratorium that the HSE has put on the recruitment of nurses is absolutely crippling our service. Our management, our nursing management, from what I can see, are trying to do their best, the nursing management. But if you have an embargo on recruitment, therefore...
Even all the overall hospital management, when you think of the bureaucracy in hospitals nowadays, the many layers that it goes through.
Well, I suppose as a nurse, we can always look on and see, and you can always see what you think isn't being done right. But I do actually really think that they're doing their best. Now, sometimes a change, you know, in certain areas may help and may improve. But I suppose the skill mix, and for a nursing point of view, it's actually the skill mix and the reduced numbers of nurses. It's just not attractive for people to come in, and it's not attractive, I suppose, to work in Limerick, unfortunately, because they see all our issues. They see that we're on the news every day. They see that practically every day we have over 100 trolleys and patients. Patients on trolleys.
And this is something that has been highlighted, that people do not want to work in Limerick because of the huge issues that are there. It's been highlighted again and again, trying to get public health nurses, trying to get nurses to work in emergency departments, trying to get junior doctors, well, they have to work there, but trying to get consultants to come to fill these roles. And you're nodding along there when Anne was speaking, Alan, in relation to, I think they're trying to do their best. Are we talking about Bernard Gloucester, the HSE? Do you think they're trying to do their best? Because the money has to be going somewhere. We were talking scoliosis services that were brought up in the Dáil, and I know that's not specific to UHL, but 17 million was given and they don't know where the money has gone. This is taxpayers' money, and if we want to give the money to a functioning health service, we want to help people, but there's just so many issues.
Yeah, well, I would come back again and underscore the issue of capacity and the fact that people are not able to access an inpatient hospital bed because there aren't the number of beds that are required.
So there are 11,000 beds in our health system since 2000. Since the year 2000, there was a report done. And in that time, our population has increased by what, over 1 million? So that's a huge issue that you're seeing. We don't have, the population has gone up and the beds just haven't.
Right, so if you look at UHL, just the UHL site, not the whole UL Hospitals group, but if you just look at the UHL site, we have approximately 484 acute hospital beds. If you look at the OECD average, the OECD average is 4.9 per thousand population. The Irish average is 2.9 per thousand.
Yeah.
And so even if we just take that low Irish average, UHL is approximately 300 beds short.
Stephen Donnelly has been highlighting the poor take-up of this new public-only consultants contract in Limerick, whereby consultants are being asked to work extra hours and to weekends. And I just saw there was a report in the paper this weekend talking about the increase in funding, and they're not getting the results back that they see for this level of funding. And even last November, he sent a letter to the chairman of the HSE talking about a hospital. He didn't name the hospital, but despite 50% increase in consultants, 60% increase in funding and 17% increase in beds, they are not getting the same output of patients per people turning up. So is he criticising the staff? Is he criticising consultants that they're actually being given the money, they're being given the beds, but you're not producing the results that they need?
So certainly, again, I would underscore the fact that capacity is an issue. It's not just an issue at UHL, it's an issue nationwide. There are statistics that suggest that The health service is short about 5,000 beds all around the country.
So is it just beds? Because he's saying the beds are there, the funding is there. The beds have increased by 17%, but they're not seeing the results.
So the beds are not there. I mean, if the beds were there, we would not have trolleys in the emergency department. Now, in relation to the new contract, it's very difficult for me to comment on what my colleagues are doing. Certainly in the UHL emergency department, over 40% of us have undertaken that new contract. But even before the new contract existed, when I started as a consultant here in 2017, the consultants who were on call, so we do 24 hours of call from 8 a.m. to 8 a.m. We were staying until 8 p.m. and potentially later. That was before the new contract. Now there are sometimes 2 of us on till 8 p.m. and occasionally till 10 p.m.
You have to go.
I was on call last Friday and I was there until midnight.
With all of this, do you think, we're talking to a campaign group in just a little while, the Midwest Campaign Group, they want to see the emergency departments reopened in Neenah, Ennis and St John's Hospital. Do you think that needs to happen, Anne?
I think that a Model 3 hospital is needed but both Ennis and Neenah are Model 2s, so I think maybe investment in that and making it a Model 3. But the clinical needs for an ED cannot be met by the EDs at the moment that are in.
Anne Noonan, a nurse in UHL and representative of the INMO, thank you so much for joining us, and Alan Watts, emergency consultant in UHL. We really appreciate you coming.
Thank you both so much for coming.
Honestly, thank you so much for coming here.
You're very welcome.
Thank you.
Fáilte over Dash Chuig Ireland AM. Now, this afternoon, the jury in the landmark Stardust inquests will deliver their verdicts.
Yes, joining us now with the latest on that story and everything else making the news this morning is Terry Prone from the Communications Clinic. Good morning to you, Terry. Thanks so much for joining us. So, after 40 years, families will find out the verdict today. It's going to be such a heartbreaking day for them and an emotional day for them.
And although the jury told the coroner yesterday that they had reached a majority verdict, it was held until 2 o'clock today so that all of the families could be present, because there was an inquest held back in the day, but there was a verdict which gave the how for each death, in other words, smoke inhalation or whatever. It never gave the why, and that's what the parents have always wanted. And what the possibilities today, there's 5 different possibilities. Death by misadventure, but one of the possibilities is unlawful killing. And I would be prepared to lay money that that is what most of the families want to hear, that their children were innocently killed by factors or people unnamed.
And heartbreaking then if that's not the verdict today, because it wasn't a unanimous decision yesterday, so it's a majority decision, so that leaves it quite open. We're going, oh, why is that?
That's very interesting. The fact that it is a majority decision means that perhaps as many as 4 or 5 of the jurors didn't necessarily contribute to whatever it was. So I would figure that there's going to be more active interest and analysis in the Stardust now 43 years later than there was at the time. At the time it was urban legend stuff.
Yeah. And the thing is, these people have had such a traumatic time and it's been such a long journey and a focus of their lives. Whatever is said later on today is not going to heal the pain. They're going to be living with this forever.
Oh no, there's no way out of the imagined horror of what happened to 17-year-olds and the insult that happened subsequently when in some way the 17-year-olds, the 20-year-olds were half blamed for what happened. Well,
at least today they will get a verdict, and that's what they have been looking for all these years, so that is good news. We're moving on to calls for a new bill for offences related to attacks in the workplace, in retail workplace. And they're calling in the city centres. I mean, just people are saying they're afraid of people coming in and robbing the shops. I've seen it firsthand.
I have too. People being abusive. That's what I've seen.
I've actually seen it in Dublin city centre. A girl, totally, probably, I don't know what she was on, came in, took a load of drink, put it into a bag, and screaming and shouting and walked straight out the door. And the guys were there, they were literally going, well, do I stop her now to get a punch, or what do I do?
Apparently, according to RG data, 93% of businesses, of retail businesses in the city centre have experienced shoplifting, but more of them have experienced burglary, in other words, that their places were broken into at night and stuff. And then your mention of the desperate fear of abuse, of racism. The city centre is not a good place to own a retail business, is the bottom line. Now, Malcolm Byrne, the TD, or is he a senator? Senator, has brought in this bill, but it's interesting as to how effective it will be.
So what's the bill? What's he proposing?
He's looked at Scottish law, and he wants very specific offences to be in the corpus of law for people who injure, abuse a retail person, the person
because the
behind
perception
the
seems to be that whatever these people do, it's a smack on the hand and off you go to do it again the next day. And there aren't enough guards in the city centre. And I think what happened last November, or last year with the riots, that has stayed with people also. And there is that feeling of fear in the city centre now.
There absolutely is. Now, Mannix Flynn has made, the councillor has made an interesting point, that it isn't just what happens in retail. There's a backstory. And he maintains that the backstory is in the estates, that the people coming in for the riots, the people coming in to do the insults and the violence, are people from the estates and are gangs from the estates. And he is making the point that although Malcolm Byrne's proposed law will address much of the problem, it won't address that backstory. It doesn't address why gangs are forming and why Dublin has a level of violence, drug use, alcohol use, which is pretty rare among European cities at this point.
Well, we'd love to hear from you at home, 0896 111 111. Have you been in a shop where you've seen this? Are you on the other side of it, where you work in retail and have been abused by people coming in? We'd love to hear your stories this morning, so do let us know. As I said, 0896 111 111. Terry Prone, as always, lovely to see you. Thank you so much for joining us. Now, after the break, Tommy Muireann are live from Limerick City.
They're continuing their discussion on the issue of overcrowding in University Hospital Limerick. That's coming up after this break.
Welcome back to Ireland AM. We've travelled to the Strand Hotel in Limerick City this morning, and we're here to highlight the ongoing crisis in Irish healthcare, particularly the one that is always at the top of the league table for overcrowding, for everything actually, University Hospital Limerick.
And of course, already we've received an awful lot of messages on this. Get in touch, 0896 111 111 if you want to have your say. Joining us now is Nick Rabbitt, senior reporter with the Limerick Leader, and Nolene Moran, spokesperson for the Midwest Hospital Campaign Group. Good morning.
Morning, guys.
To you, pair. It's great to have you both with us. Nick, listen, you are working with the with the Limerick Leader. You've been reporting on UHL for the last 10 years, but it really seems to have ramped up, particularly in the last year. Why so?
Well, I mean, I think you can trace this whole ramping up, as you say, back to the closing down of the accident and emergency units at St John's here in Limerick City, Nina in Tipperary, and Ennis, obviously, in County Clare 15 years ago. The idea then was to create a centre of excellence down in Limerick, bring the best people here to Limerick. Unfortunately, that really hasn't happened. We've had this bottleneck created instead, and there's just been insane pressure on one emergency facility.
We were talking to an emergency consultant there just a little while ago who was saying that the EDs, while they have closed down in certain areas, Nolene, 15 years ago now, that he doesn't think that emergency departments should be back open in places like Nina, Ennis and St John's because it wouldn't be safe. The staffing numbers aren't there. your group doesn't agree with this.
No, and we say that what's happening at the moment in University Hospital Limerick Emergency Department is not safe. Because patients are being denied access to care in a timely manner. People are afraid to attend the emergency department, which is not safe, which is not a healthy situation to be in.
Talk to me about that. You're saying people are afraid to attend the emergency department in University Hospital Limerick.
Yeah.
Why?
Because anyone that goes down there has to wait very long periods of time. If they do get seen to and they do get into the hospital, it's accepted that it's a very good hospital once you get past the emergency department, and we don't fault the staff and we don't fault the doctors, and we understand that they're all doing their best. But people are dying unnecessarily in that hospital. The cases are coming one after the next. The inquiries are there. Nick is reporting on it on the Limerick Leader. It's on the Clare Champion. It's on the Nina Guardian. All the local papers, local media have been very, very good in reporting on the issue and putting the focus on the issue. But the problem is that it is not a safe place to get care at the moment, and something has to be done about it. So that's why we are saying that there must be another emergency department in this region. Every other health region in the country has supporting Model 3 hospitals to help with the Model 4s. This area is distinct and different and doesn't have that support.
Your group protest against Minister Stephen Donnelly last weekend. I know you have another protest coming up in 2 weeks. The budget, the money that the government are throwing towards the health system in general, but particularly to the hospital here in Limerick, is pretty extraordinary. So where is the money going, and what do you want him to do?
Well, the issue is that we have a population of over 425,000 people attending just one emergency department. The emergency department was built for a max capacity of 70,000 people, and there's annual attendances of over 86 people, or over 86,000 annually. So we have a population of 425,000, all dependent on one hospital in the region. The problem...
The staff has risen, as we've mentioned earlier on, over 1,000 staff in 4 years. 45% of the original budget has been put on top of it as well. So they are trying. But is it just not enough?
It's not enough. It's not enough, and the problem here is that there's a lack of recognition of the problem. So they're not looking at the fact that the emergency department is too small for the region. They're not looking at how they can look for an alternative emergency department for the region. Like Ennis does not have an emergency department. The whole of County Clare has to attend University Hospital Limerick or attend Galway University Hospital, and that's putting pressures on those emergency departments there. If we had an emergency department reopened in Ennis, it would make a massive difference and alleviate the pressures both in University Hospital Limerick and in Galway.
There's a message here. There's so many messages coming in this morning, and we really appreciate this. It says, our 15-year-old son suffered a spinal stroke in September 2021. We live in West Clare. I rang for an ambulance to say my son couldn't walk. I was told it was so busy it would be better if I drove him to UHL myself. Once we got there, it was like a war zone. There were patients everywhere. Conditions have worsened since then, and my son is terrified of having to go back. There's so many messages here, Nick, from people's lived experience. Alan, who was the emergency consultant we were talking to, he acknowledges, he's like, once you get through, as you said, everything is working absolutely fine. When this all started, 35 people on trolleys 15 years ago was making headlines. Now we're seeing 100, 120, 150. Yeah. Is anyone listening to what's going on here?
It's a great point you make about the 35 people on beds. I remember writing a front page story about that in 2010. For the Limerick Leader newspaper.
14 years ago, 35 people on trolleys, and it was
that was actually considered a scandal back then. And now look at where we are. We reached a high of 150 patients on trolleys in February of this year. There was 105 yesterday. There's a feeling, I talk to lots of people, and there's a feeling that, as was said before, they won't go to, that they might put themselves in danger because they don't want to go to the emergency department here in Limerick because it's got such a bad reputation. And it's a terrible situation. There's people who will travel to other emergency departments across the country because they feel they will get treated quicker. And as you say, I think the important thing to get across is the staff, nurses, consultants, doctors, they're amazing. They're doing their best in a very difficult situation.
No, this is what you said. I don't fault the staff or the doctors. You just said that a minute ago. Whose fault is it?
Well, first of all, our campaign has no backing from any political party to call for the reopening of the emergency department. So it's political failure in the sense that nobody is listening to what's happening to the people in this area. But also the Chief Clinical Officer is the person that advises the Department of Health, and his clinical advice does not permit the reopening of an emergency department in this region. And I think the Chief Clinical Officer needs to come out and say how he justifies this in light of the people that are dying unnecessarily on trolleys, who have no dignity when they go into that emergency department, who are left for hours on end. I think it's time that the Chief Clinical Officer would speak up on this and say how he justifies this clinical advice, and how he says, like, it's one, his advice applies to the whole country, but our area is distinct because it doesn't have the same supports as every other hospital region in the country.
Listen, you of course have a newly elected MP, Patrick O'Donovan, who represents Limerick. We asked him to come here to speak to us here this morning. He's too busy doing something in Dublin. He must realise what a situation is going on in University Hospital Limerick. Do you think he can make a difference? Because like, just reading some of the messages here, it's just frightening what people, like, it's actually how people are scared. And we have a message here saying that they would prefer to go to Galway Hospital, even though they live in Limerick, because they'd be afraid that their loved ones might not come out alive.
Yeah, people tell us that they would prefer to die at home than travel in here to the emergency department, and that's not good enough. It's not acceptable. But the politicians, there's no, like, the local media have been excellent in the way that they've covered this issue, and thanks to yourselves as well for coming down today to put the focus on it. There is nobody that can say that they do not know what is happening out in University Hospital Limerick, that they're unaware of the problem. But the problem is the will is not there to fix it. And we've had a Minister for Health after Minister for Health, and they are hiding behind this clinical advice that has been handed out to them, and they say they cannot act to change the situation without the clinical advice being adjusted.
Well, we're certainly going to be talking to politicians later on in the show and putting this towards them. Nolene Moran, Care Coordinator for the Midwest Hospital Campaign Group, who are marching again on the 25th to the Dáil, and Nick Rabbitt, Senior Reporter for the Limerick Leader. Thank you both so much for being with us this morning.
Lots more still to come here on Ireland Down. We'll be back very shortly.
Good morning, hello, you're very welcome back to Ireland AM. If you've just joined us, we're coming to you live from the Strand Hotel in Limerick City today.
Yes, all this week we have been turning our attention to Ireland's health system, particularly here at University Hospital Limerick, where overcrowding, trolley figures remain a massive, massive issue.
Earlier on, we spoke to medical teams addressing these concerns on the ground in UHL, and at 8:15 this morning, we're going to be hearing from families who's been affected by the challenges at University Hospital Limerick.
And of course, we would always love to hear from you this morning. So if you have anything related to health in this country, but particularly here at UHL, send us a message, send us an email, send us a text 0896 111 111, or email us at irelandm@virginmedia.ie.
There are so many, we're going to get to as many as we can. There's lots.
8:45, we'll try and read a lot more.
Absolutely. Gràinne and Alan, they have been holding the fort in studio. Back to them both for now.
Thanks, guys. Yeah, still to come here in studio from the hits to the misses. Our movie expert, Brian Lloyd, is here to guide us through your weekend viewing.
We're also rummaging through the wardrobe. We are rummaging through the wardrobe of pop culture phenomenon Taylor Swift. We're going to be taking fashion inspiration from her many musical eras on the catwalk. That's coming up at 9:35.
Looking forward to that. And the amazing Alberto Rossi is in the kitchen this morning. Alberto, buongiorno.
Buongiorno.
What are you making this morning?
This morning we're making pasta and patate, the perfect blend of Italian and Irish pasta with potatoes.
Pasta and potatoes, is that it, yeah?
It's a Napolitan specialty, so obviously I'm not Napolitan, but we're going to make it.
So it's an overload of carbs this morning.
We'll all be flat out, straight to bed afterwards.
Looking forward to that a little later on.
That man could say we're making cornflakes and milk.
And it sounds good.
Amazing. Yeah. Time now to take a check on the morning's papers, starting with the Irish Times. Its headline, airlines may face higher fines under immigration reforms. Airlines could face higher fines and be subjected to tougher legal obligations to check the documents of passengers flying into Ireland under proposed new immigration reforms.
House prices rise by 6% as buyers bet that the rates have peaked. That's the front page of the Irish Independent. The possibility that interest rates have peaked and will fall have been cited as one reason for the pace of the property price rises picking up.
The Examiner leads with toxic content fed to teenage boys. Children are being directed to dangerous, toxic online content by social media company algorithms within minutes of use, sparking calls for urgent action.
Charity to hospital, give us back our property. That's the top story of the Daily Mail. It reports a legal battle is being waged against Beaumont Hospital over its failure to hand back a property loaned to it by the Irish Kidney Association during the pandemic.
The Mirror goes with gangsters' paradise lost. Gangster David Waldron and his wife must hand over assets worth €3 million, including a luxury home, after losing a battle with the Criminal Assets Bureau.
The Star also leads with that story in its headline, "Where did Mall go wrong?"
The Sun leads with praying for justice. The Stardust inquest's jury's long-awaited verdicts will be delivered at 2 p.m. today. The panel yesterday revealed they had reached majority verdicts, and this comes almost a year after the inquests.
The Herald goes with "Sue You Later, alligator." A couple have launched a High Court proceedings in a dispute over the ownership of a garage where they keep exotic pets, including, listen to this, scorpions, chameleons and an alligator. There you go, as you do.
An alligator is not just for Christmas.
I tell you, there you go.
After the break, Tommy Muireann are live from Limerick City to discuss the ongoing issue of hospital overcrowding.
Yes, they're going to be speaking with those directly affected by the challenges in the University Hospital Limerick coming up after this short break.
You're very welcome back. Now, we have been chatting all morning about the ongoing struggles in Ireland's healthcare system. We've been talking about this all week, but especially here at University Hospital Limerick.
And we are here in Limerick City to speak with people who have felt that impact firsthand. Joining us now are Rebecca Power, Christine Tracy and Marie McMahon. Thank you all so much for being here. We really do appreciate it. Rebecca, can I start with you? You have an autoimmune disease, so you have been going in and out of UHL for 10 years now. Is that right?
Yeah, so it's probably just over 10 years. Most recently, I was in February, and I think what's most worrying for everyone in the Midwest is the situation is getting worse. The stories that I can tell from 10 years ago, I can say the same stories again. In February when I was in, we'll say the corridor where I was, there was 7 of us stacked up, we'll say, against the wall. You have a situation where you have what's most upsetting, I suppose, elderly people, very vulnerable people. There's no facilities there to even contact nurses. So it's not like you have a bell beside your trolley. So the only way these people can get the attention is by calling out for help. And it's chaos in there, and it's mayhem at the moment.
So
absolutely.
Explain what it looks like. If people walk into the emergency department, when you say there's trolleys back to back, like I heard there's over 180 people on trolleys just lining corridors. Like, what's it like for toilet facilities, for people who are like really, really sick?
Yeah.
How bad is it?
So when I was brought in February, prior to this, I'd said, under no circumstances am I going back into the regional hospital. And there's many people in the Midwest who have this, they're scared to go in there. But on this occasion, I had suffered a collapse at home and I had a concussion. So I was brought in by ambulance. There was no other option. Limerick is my local hospital. I was brought in, so for the first, let's say, 24 hours, I was kind of in and out of sleep, so I wasn't really fully aware, I suppose, if the surroundings are taking any notice of kind of what was going on around me. And then I had gotten up at one point and I needed to go to the toilet, and luckily my partner was with me, so the toilet in our zone was closed, it was out of order. So we had to walk through, we'll say, the main triage kind of waiting area. This is where people are waiting for trolleys, we'll say. And I just remember looking up at one point and looking at him and going, oh my God. There was people everywhere. So there was people on the couches who were trying to rest. There was people who were receiving their intravenous drip. There was people vomiting into, we'll say, their buckets or whatever. These were people that were still waiting for trolleys. Now, on that occasion when I was in, I think it was recorded that there was 154 people on trolleys. So it was exceptionally busy. And yeah, it's
154 on trolleys, and let's reiterate the point. 15 years ago, when 35 people were on trolleys, this was making national news. Now we're expecting this to be broken every single day. Christine, you were recently in UHL, and this was because of your husband.
Yes.
How long did he end up on a trolley, and what was happening with him?
4 days.
4 days
on a trolley.
Trolley.
Yeah.
In the emergency department?
If you call it that, in the war
He hadn't
zone.
been admitted to a ward.
In the war zone.
War zone.
The war zone.
I mean, when he was originally admitted, he was brought into ambulance resus, and we were quite happy because he was in this little room and everything was grand, and we said we'd leave him rest and go home. Next morning we went in to see him. It was like a complete 360. I was like, only if my daughter was with me, I wouldn't have been able to see him, because we had to walk sideways because there was trolleys on both sides, bumper to bumper.
You actually have to walk
female.
sideways to
Yes,
squeeze through.
yes, on that occasion anyway. We had
So
to,
men and women stacked up in the same
yeah,
areas.
yeah.
And as you said, and it's not like you're on call. For staff members, obviously you need to you kind of have to be high. You've said that they were just running around and you didn't want to impose on them.
That's correct, yeah.
Is that how it felt?
That's how it felt, yeah.
But at the same time, there's a cacophony because everyone's kind of crying out for help.
Oh, yeah. There was one elderly gentleman alongside me, and I would think he had dementia because he was attempting to get up at different stages, you know. So I said to him, I'll get you a nice cup of tea if you sit down.
Yeah.
So that kind of placed him for a little while. Then he wanted to go home. So I said, I live near you. I'll be going home in about an hour. I'll give you a lift. So that said to me again. But next day when I went in, he was on a trolley with a gown on, and his legs were out over it. So it was obvious to me that he had taken a fall because his shins were all scratched and scraping and everything.
Your husband, Patrick, he's 73.
That's correct.
He got taken into the hospital.
That's right.
73 years of age, you would think that hopefully you'll get seen very quickly.
Yeah.
He was on that trolley for 4 days.
Yes.
What was his experience like?
He was saying to me, will you try and get me out of here?
Like,
And he was
get me out.
Get me out. And I came that close, but I knew I couldn't because when he went in, he had sepsis.
Oh, wow.
So I knew I couldn't do it because he was on a drip, but I felt like doing it, you know.
Even though he knew he was extremely ill, it was that bad, he said, I prefer to be out of here and be sick.
Yes.
And dangerously sick at home.
Yes.
But what was so bad about it?
It was so claustrophobic, you know. You couldn't.
Can you sleep? Because I'd imagine in an emergency department, the lights are on.
He actually stayed on the armchair all night.
All night?
Yeah.
How is he doing? Because he wasn't seen to for 4 days, but on a trolley for 4 days or on an armchair.
Yeah.
How is Patrick?
He's very good now, thank God.
He is.
You see, he was 3 days post-op after having shoulder replacement in a different hospital, which was fantastic, you know. And I have to say this about the medical staff in UHL, from the nurses, doctors, consultants.
This is what we hear all the time. It's getting through the emergency department and even an emergency department out there. And you're all shaking your heads, but
I don't know how they motivate themselves to go into that scene every day. I
spoke to the nurses there earlier on, and just how difficult a situation it is, and that it is just constant firefighting over and over again.
Marie, you're sitting there at the end, and I want to commiserate with you today because it's the anniversary of your husband's death today.
On a trolley in UHL.
6 years.
In the emergency department, in exactly the same circumstances that Christine and Rebecca have described. And nothing has changed, and in actual fact it's got worse, despite the promises that were made to us by UHL that they've learned from our experiences. And I understand that everybody else has been told exactly the same story, that you go in, you talk to them, you discuss what happened or what didn't happen, and they make these promises, and yet we have people going through the same thing 6 years later. And, you know, it's not acceptable.
What happened to Tommy?
Well, Tommy
it was
suffered...
2018.
Sorry?
It was 2018.
Yes, and he suffered from a rare condition called amyloidosis, and he was susceptible to strokes and blood clots, and he took ill, so he was taken by ambulance in there. and he was on a trolley for 36 hours, approximately 36 hours. For the first 14 hours, he didn't see a doctor. So the way, I know you had the INMO on earlier, and they count. So they would have counted Tommy as a patient in the hospital.
Yeah.
But the new system under the HSE and the health department is what they call trolleygar. And for the first 14 hours, Tommy wouldn't have counted. And anybody that goes in there now, unless they've been seen by a doctor, don't count. And that's a huge issue for me and for everybody else.
Because they're in no man's land. They don't.
Yeah, it dehumanises people. But Tommy was found dead on the trolley, according to his notes. And we only found that out when we got his notes. We weren't told that by the hospital.
Can you explain to us, because he was taken into hospital with stroke-like symptoms. He was waiting to see a doctor for 14 hours. You were there by his side. You went home, you came back, you spent the day with him, and then you were told to go home again.
He told me to go home, or he was coming similar, you know, to others. You know, he told me that he was going to come home, he was going to walk out of there, and if I didn't go home.
And then you realised you had a missed call.
Yeah. I had a missed call from the hospital, and I rang them, and they couldn't find anybody to speak to me at first, but eventually I got through to somebody. So sadly, he passed away at 4 o'clock this morning. But when we actually got his notes, he'd actually been found on the trolley at something like, I think it was 11:10 the previous evening. But I mean, you know, that's, yeah. But that's a symptom of what's happening in there. And, you know, as everybody has said, it's not the staff, it's the pressure they're under.
This is it. You're sitting there. This is heartbreaking. Like, it's his anniversary today. And it's not the staff. This is what everyone is saying. When you're in there, they're going around like you're a frequent flyer. What do you want to see happening, Marie? Because you've lived the worst of this. What needs to happen?
I think there has to be acknowledgement from, you know, we keep hearing that emergency departments can't be reopened because the clinical experts don't recommend it. Well, they're the very same clinical experts that closed the emergency departments in Ennis, Nina and St John's in 2009, and they promised us a centre of excellence. Well, what we've got is a centre of disaster. Yeah. You know, I live in North Clare. It takes me over an hour alone to access the emergency department in UHL. We've got one emergency department for nearly 500,000 people. That's not right. It doesn't happen anywhere else in the country.
Because UHL is a model 4, and an awful lot of other places, when you've got a population this side, would have a model 3 to support it. But we only have model 2 hospitals around the place who do excellent work.
Oh, they do.
Excellent work. But you want these to be open.
I mean, we have people in Clare whose only access is UHL, and they live up to 2 hours. We're 2 hours from UHL, and as I said, I myself am over an hour.
I'm sorry, Marie, I just have to ask you though, like, and we're demanding this, and health ministers, we've asked them to come down and speak to us today. They're all too busy to talk about it. When you're saying you got a phone call, you couldn't get someone to talk to, your husband died on his own, on a trolley, wasn't found for hours.
Well, no.
You're frustrated. Sorry, well, you're like, you've spent so much of your life with him. It must break your heart to just think that other people are going through this.
Yeah, it does, and that's why I do what I do. You know, I don't do it for myself. I do it for everybody else, because no family should have to go through that pain and that torment. And, you know, Christine and Rebecca have explained their own experiences, and as I said, there's many people in there on their own, you know, who have nobody to advocate for them. And, you know, that's not, and it's also the pressure on the staff, you know, it's not acceptable.
Christine, from your point of view, would you be scared to send Patrick back into the hospital?
Yes, definitely.
For the fear that he might not come back
Exactly,
again?
yes.
Like, that's how bad it is. Your local hospital, you're actually scared to go in there.
Scared of any of my family, myself included, to ever have to go in there.
This is, you know, hearing from people who have to deal with this from the worst case scenario, to someone very recently, to a frequent flyer, Rebecca. So you're in and out, seeing at a rate that an awful lot of people wouldn't have to. Do you not get to bypass go? Collect your €200 because they're like, oh, she's got an autoimmune disease, we know what's going on, we know what we need to do?
There's situations, I suppose anyone that ends up in the A&E, it is an absolute last resort, and the system is the same for everybody. And even the last time I was in, there was people that had been there 5 days, upwards of 5 days on trolleys.
They promised, they just started last week when Stephen Donnelly was here. 2 weeks ago, on the 4th of April, he said, right, we're going to bring in all these things. We're opening up to 70 beds in this ward. We're going to have GP, which they started last week, 24-hour GP and nurse on-site practitioner care in the emergency department. Is this good enough? Are you happy with what he announced?
A drop in the water. I mean, if we're talking about 134 people being on trolleys, already we've seen the numbers throughout January and February of people presenting at UHL increase, so that's going to continue to increase. So even these small numbers of beds that are going in, it's not going to facilitate the people. There's just too many people in the Midwest, 450,000 people that are trying to use this service. And the campaigns that are happening, the fantastic work that people are doing is to open the other hospitals, and that's what needs to be considered.
Yeah.
We, of course, did mention this to UHL that we were coming down, we were speaking to you. We got a response from them that they said, while we are unable to comment on the details of individual cases, we do regret the long wait times for a bed and the challenges around the privacy and dignity currently being experienced by patients in the emergency department in the University Hospital Limerick, including the guests on your show this morning. This is not the standard of care we wish to provide for our patients. We apologise to patients who have been impacted and would like to reassure the public that health and social care teams across the region are working hard with existing resources and at capacity to reduce long waits. And I think that this says it all, that they are working as hard as they can, but they don't have the resources or the capacity to reduce these waits.
You're shaking your head.
Yeah, I mean, the staff on the ground are excellent, and you know, we say that. We don't need them to tell us that. We know that, and we keep saying that. But this is, I could have read that out to you 6 years ago. I could have said, we could all say the same things. Their apologies are meaningless. Absolutely.
There was a mother of a scoliosis patient recently who just said they need to stop treating healthcare as politics and political football.
Yeah. Definitely.
Because surely it's a healthcare system, they all need to work together. But it feels like Marie, do you think it's like, do you want all political parties working together on this to get the best
it would be excellent, first of all, if they supported the people of the region, because that's not happening. None of the parties, as you know, support the reopening of the emergency department. But it's interesting you mentioned the 70 beds. Those 70 beds are 50 in Nina, which is a purpose-built community nursing home, which has been taken over by the HSE, and 20 beds in Ennis, which has been taken over by the HSE.
Yeah, I mean, there's just so many questions. Nobody seems to have answers. Get in touch with us, 0896 111 111. We would love to hear from you. Rebecca Power, based here in Limerick, Christine Tracy, and your husband Patrick, and Marie McMahon, on your 6th anniversary of your poor husband Tommy passing away. Listen, we really appreciate you coming on and sharing your story. Thank you so much.
Hope it'll be a worthwhile.
We really do hope so, and Marie, we're so sorry. The fact you came in today, we appreciate it.
Thank you.
Now, before the break and the news there, we were down in Limerick with Muireann and Tommy, and like some just harrowing stories of people and what they've experienced at UHL there in Limerick, and especially Marie McMahon, whose husband died on a trolley in the hospital. And they were saying, like, it's supposed to be a hospital of excellence, and she was calling it was a centre of disaster. And that's the type of feedback we're getting this morning. And look, we're saying that the staff are amazing.
Yeah.
And they're sort of saying, if you open new beds and stuff like that, if the staff aren't there.
I just think, if you could try and place yourself in that situation where the love of your life, the man you've spent your life with, dies in that situation, and you're not there and nobody's there.
And to get the phone call saying he died at 4 in the morning, where he actually died at 11 the night before.
5 hours before that. It's indignity on top of insult, on top of trauma.
And keep the text coming into us, because you've been sending so much text about your experience, not only in UHL, but in hospitals around the country, because that's what we're here for this morning, is to highlight what's the problems in hospitals, and especially in UHL. So we really do appreciate those texts coming in, 0896 111 111. We would love to hear from you, and we'll be discussing it further. throughout the programme. But now we're changing it onto something totally different. Alberto Rossi's in the kitchen. Good morning to you, Alberto.
Good morning, Alan.
So
Good
what are we
morning,
having this morning?
This morning we are making pasta e patate, so pasta with potatoes. That sounds odd.
Very Irish.
And very the best of Italian and the best of Irish, okay? But it's one of those poor dishes that normal people used to have, and it's from the Napolitan region, so Campania, Napoli. And I never knew that this exists until a colleague of mine always tells me, oh, pasta e patate, and I say, all right, we'll try and make it.
So it's just pasta and potatoes. So
Pasta,
like I just
potatoes,
say,
vegetables.
Very filling.
Absolutely.
And cheap.
It is, it's cheap. People needed to feed themselves and get the most out of it.
Yeah.
So you got double the carbs.
Double the carbs.
Thank you very much.
We're all right for that.
Then you gotta go work. You can't just go sleep on the sofa.
How do you start with it?
So we have a pot with some oil, then we have carrots, celery, and onion. In Italian we call this the soffritto, that gives all the flavors. And then we have some lard. So lardo, it's an Italian, it's like, look, this is the guanciale. You see how there is all the fat?
Yeah.
So that's the part that we're gonna use, because it melts, it gives flavor to it. And we also have some rosemary. So I have there the oil. I put in a little sprig of rosemary. Okay, then I put in the lardo.
But we'd have lard here, wouldn't we?
Yeah, you can have the lard.
This is different.
This is different. This is sliceable, you know.
This is proper stuff.
You can probably buy the lard or the beef drippings from the butcher and use that.
Has that been smoked or something? What
That's been smoked.
Yeah, okay.
You can smell it, you know, and it makes the house smells fantastic. So you put the lardo in with the rosemary and the oil for about a minute, just to make sure that it starts to
Where did you get the size of these onions and potatoes?
Spanish onions.
I was looking at it.
The size of that.
Yes.
And then you start your soffritto with carrot, celery, and onion, and it starts to smell fantastic. And it's just about a minute. Now, those are cut, I would say, diced, but very, very small, okay, the vegetables, you know. You can even chop them if it makes it easy for I can dice, no problem. But
and do they have to be small? You don't want
Yeah, they have to be small because you don't want to see big chunks. But then the potatoes is big. It's about 2 centimeters cubes, okay? Now, it's not that you have to pull out the ruler and cut 2 centimeters, okay? But big enough, because you need the potatoes to cook, and then you need to break them. So I have here, okay, just a couple of minutes, and then you add your potatoes.
So nicely chopped up.
Nicely chopped up, you know, nice pieces, okay?
Could you slice them? Would that be easier?
No, I slice them, they might cook a bit too fast.
Too fast.
And they disintegrate,
Okay.
exactly. So then I put some salt, okay? And some black pepper.
Cool.
No, not too much. And then you have water, okay? You just add the water to the potato.
Just water, not a stock in it.
No stock, because all the flavor comes from the vegetables and the lardo, okay? And then you let it cook for about, I would say it takes about 17 to 20 minutes for the potato to
Just
start
like
to go
that,
soft.
keep stirring it, make sure it doesn't stick to the bottom.
Then
This
what
is all
happens?
stuff, bar the lardo, that you'd have at home. There's nothing fancy
Exactly,
here.
nothing fancier. This is popular food that people used to cook once they finish work, and so
Seriously,
you don't
where
need
did
to
you
go
get
to
that
special.
onion? The size of it.
I know it is. It's,
I know, we get them in
Look at the size of
Imagine, we can get them bigger than these if we want.
Really?
It's amazing, yes. I don't like them when they're too big. You know, you need a bag just for it, you know. Then a secret part of this is that you add the crust of the cheese. So that will be the heel of the Parmesan, okay? So the Parmesan cheese comes in a piece, and there is always a hard.
So the bit that you think has gone off?
Exactly.
Yes, the bit that gets thrown away.
We used to fight about it when we were kids. So what you do is you just scrape the back of it, so you remove some of the dirt that might be on it, okay? And then what you do, you dice it too, as big as the potatoes, okay? Now this is the secret part of the dish, because you remove the cheese that melts inside the potatoes, okay? And then you have the crust, that is the hard part, so that gives you a bit of bite, okay? So this will cook, will bring to the boiling, and then once the potatoes are soft, with the back of your spoon, you smash half of the potatoes, so you get a nice creamy consistency. And then you add your pasta. Now,
Any particular pasta?
In Naples, they use a pasta that is all broken, and it's different kinds. So you might have penne pasta, you might have some of the fusilli pasta. You can break them up and mix them up. It is one of the only recipes that call for broken pasta, and you can mix it.
Yes.
Okay.
Don't go mixing pasta at home. You know, it's no good. All right?
Don't do it.
Don't do it.
Don't do it.
It's against the regulation.
Against the religion, yes.
Exactly. And then you put in all the pasta in there. And again, you're going to have to add more water once you add the pasta.
What shape pasta is that? I haven't seen
Oh,
that
these are
before.
called the caserecce, so they're like rounded up, and
Yes.
you know they're very good here. Look, they're very nice because what they do is they capture all the
the
flavor
sauce.
inside.
Yeah.
You know?
See it.
Yeah.
And you cook, basically, you cook the pasta in the same water that cook the potato.
Okay.
All right? And then you let it cook. It takes about 17 minutes, and this is how it is. So it is a very creamy dish, as you can see, because obviously you broke half of the potato, the other half you left them all. So it gives you a whole different consistency, okay? And it is very, very nice. You can have this, you can make it and keep it in the fridge for a couple of days.
Would you put anything over that?
I put a little bit more cheese because you know how we like it.
There's a hint by Alan.
Yeah.
And then a little bit of olive oil, okay, to keep it nice and fresh.
Go, Gràinne.
I put also some parmesan at the bottom of the plate just because it makes it look fancy. You know?
Are they your plates from the Intercontinental Hotel?
You know I like to show off the plates that we have, you know.
But they're beautiful. They remind me of the plates your grandmother would have.
Exactly.
Yes.
You know, they're very Italian in a way.
Would you ever serve something like this in the hotel, or is it Intercon too posh for this?
Could be a little bit, not too posh, but it's about knowledge also of food. And, you know, we do something similar that I did before with the chickpeas. It is exactly the same thing. You cook half the chickpeas, you mash them, and then you add your pasta and you cook it. So we try to do it now and then. And we always have pasta of the day in the hotel.
Of course. It's lovely, and I know I'm going to want to go to bed and have sleep after.
Very filling. I can see what you say about it.
You need to work for it. You know, if you eat it now, you go sit on the sofa and then you're just there like this watching Netflix.
Yeah.
But it's a beautiful dish.
Comfort.
Exactly. It's comfort food, family food.
Yeah.
You know?
Alberto Rossi from the Intercontinental Hotel, thank you so much for joining us this morning. That is delicious.
Absolutely gorgeous.
Now, we are going back down to Limerick to Muireann and Tommy. Guys, some heartbreaking stories there earlier on.
There really is, Alan. So difficult to see what people have been going through, not just this year, not just a few years ago, going back 10, 15 years. The stories we've heard this morning of what's going on in University Hospital Limerick, they just break your heart. And it's something we read about in Dublin. We get so many text messages in from people with their experiences all the time, and it's just really nice to be here in Limerick and hear from doctors and nurses, and looking forward to talking to politicians about it coming up very shortly.
But again, everyone is saying that every person who works in a hospital is absolutely fantastic. So why doesn't our health system work, and who is answerable for it? So we are talking to some politicians from across the spectrum very shortly. You're looking forward to getting some answers?
Yeah, and of course we're going to be reading out text messages after this break as well, so do send them in to us, 0896 111 111. We're going to go through those when we come back.
You're very welcome back. Now, all morning we've been hearing the very upsetting and harrowing stories of people's experiences in University Hospital Limerick. And we've been asking for your stories, and we've been overwhelmed by what you've been sending in to us. We just want to give you a couple. One text says here, you could build 300 extra beds in UHL, but if there aren't enough nurses to manage it, then it won't make a difference. The solution is to hire more staff.
And that's the thing, it's been saying it, and we have to say that nobody's giving out about the staff there.
In
and
fact,
about the staff
everybody's saying how great they are,
they're
but
amazing,
they're overrun.
and they're just overwhelmed by what's happening there and in hospitals right across the country. We have another text in. I visited my mum recently in UHL in the A&E department. She was stuck in a trolley near the toilet, which was filthy. I would rather be ill at home than go there. They seem to be so understaffed. And that's the feedback we've been getting from a lot of people, even talking to some people who had personal experience, and they said that they would fear going back into hospital. Imagine that you actually fear that if something was wrong with you, you'd rather not go to that hospital.
That's right.
And you'd probably delay calling somebody or going to the doctor because you might be transferred there.
Yes.
Which is scandalous, like in the country in this day and age.
I know, it's such a wealthy country.
And such a wealthy country. So keep those texts coming in. Tommy and Muireann, these stories definitely overwhelming, and you've been getting more reaction down there in Limerick.
We have, Alan, yeah. And like you say, I don't think anybody's putting the blame on the nurses and the doctors here, bar maybe Stephen Donnelly and the health service.
Yeah.
And we just, in talking to them, in talking to people who've experienced everything going on in University Hospital Limerick, it's just the frustration and the disappointment. As you say, we're in a wealthy country, a country that is booming. But should we have to put up with a health service that is so far behind, like archaic, you would say, certainly in terms of trying to be seen.
Let's hear some of the stories people have been sending in. I was brought to UHL by ambulance from the scene of a head-on collision. I was in severe pain and I was left in the waiting room for hours. After 12 hours waiting, I asked my brother to pick me up and bring me to a different hospital where I was seen immediately. I will never go to UHL again.
My vulnerable daughter was both physical and intellectual challenges, was admitted to Limerick Hospital on a Monday. She remained on that trolley for 98 hours until the Friday before she finally got a bed. 98 hours. I mean, someone with intellectual and physical challenges, disability, it's just mind-blowing.
My mother has dementia. She ended up in a trolley on UHL for days after a fall, and it was near impossible for us to get through to anyone to find out how she was doing. My sister went to the hospital to visit her and found my mother lying on a trolley. She had been in a chaotic corridor for days, and we've heard stories about dementia patients this morning who are on trolleys. We have seen reports of dementia patients from UHL being discharged during the night to try to free up that bed, and they get confused because they don't know what's going on there as well.
My aunt was in a hospital bed for 3 weeks, more than she needed to be, because she was waiting for a bed in another hospital for an operation. Again, we hear that as well.
They said they're bringing on step-down beds. Stephen Donnelly has promised that he's going to bring down step-down beds in the region, so that will free up more beds in acute care.
They say, and they are delivering maybe 10 or 20, but is it enough when you're talking about thousands and thousands of people who need it?
22.8 billion. That is our healthcare budget in Ireland, just to let you know. Lots more coming up on the show. To get in contact, it's 0896 111 111.
See you back here shortly.
Hello, welcome back to the final hour of Ireland AM here in the Strand Hotel in the wonderful city of Limerick.
Biased.
He's keeping going like this to me. We're here and we're discussing something incredibly important. It's Ireland's healthcare system, and in particular we are of course talking about the University Hospital Limerick, where overcrowding and trolley figures, they're always at the top of the league tables, and these are not good league tables to be on. It's really bad.
From wonderful.
Yeah.
All morning we have heard from patients, we've heard from families, we've heard from hospital workers who have been affected and have been dealing with these issues. So at 9:20, we are going to be putting some of those issues to our panel of politicians.
Absolutely, and we have spoken to staff from the hospital who want to get these issues out there and spoken about. We have had a huge response and we want to hear more of your stories. We'll get to as many as we can throughout the morning. You can get in contact on 0896 111 111.
Yes, but for now, let's get back to studio to see what else is coming up with Alan and Gràinne.
Thank you very much, Tommy. Very interesting to hear what the politicians are going to say to that. Now, that's the thing, because when you hear those stories, you can't sit there and defend that.
And it has to be a live election issue. It has to be.
No, totally, and it will be. It definitely will be. But back here in studio, from a trending thriller to telly talent, we're getting a roundup of what to watch this weekend. Brian, what are we going to be chatting about?
Talking about Baby Reindeer, which is this really buzzy show on Netflix. It's getting a lot of people talking about that. And we're also going to be talking about Abigail, which is this new horror that's out in cinemas this week, and it was filmed here in Ireland.
Yeah, little Alicia Weir is in it.
Alicia Weir, yeah. She plays like this ballerina vampire, yeah. It's great crack, though.
Good.
And
ballerina vampire.
And Dan Stevens is one of my favourite actors.
All right.
Yeah, can't wait.
Good.
Can't wait. Brian's got what to watch. We've also got the fabulous Mandy Maher with us on Style Watch on the Catwalk. Mandy, what have you got for us?
Good morning to you, Gràinne. So this morning, it's all going Taylor Swift crazy in Ireland at the moment, of course, with her concert happening in June. But tomorrow, of course, is the launch of her new album. So this morning, it's all about Taylor Swift vibes, the various pieces that she's shown over the years with her various tours and albums. That's what our looks are based on this morning. And I'm loving this look. This is our boho look, her lover look, I should say. And I'm loving it. It's really, really beautiful. So great pieces to show you this morning. All a bit of fun.
I could just see Mandy Maher when she got that brief. I have to do what? I have to go get 6 outfits and look like Taylor
Swift. That is exactly what I did say. I said, are you sure you actually want me to do a Taylor Swift? Only for the models filling me in all about Taylor Swift this morning coming up in the car. That's the truth. I'd be completely winging it otherwise.
It's a collaborative.
Taylor who?
It absolutely is.
Oh, Mandy, you're going to be brilliant. It looks fab already.
We are live from Limerick City, and after the break we are going to continue our discussion on University Hospital Limerick with a political panel.
Yeah, see you back here very shortly.
Welcome back to Ireland AM, where we're live from Limerick throughout the morning. We've been exploring the challenges that are facing University Hospital Limerick. We've heard the ripple effects it's had on families, communities, and the incredibly dedicated hospital staff who are dealing with issues of overcrowding and underfunding every single day.
Now, of course, we want to put this to the government. Simon Harris is busy in Brussels at the minute. We got a straight no from Stephen Donnelly. And of course, Patrick O'Donovan, the newly elected TD, we thought we'd like to get his face on the screens and represent his area of Limerick, but unfortunately he is handing out handing out a medal in Dublin, so probably a bit too important for him. So no offence to these guys, but Minister of State Fine Gael TD for Limerick City, Kieran O'Donnell, Fianna Fáil TD for Clare, Cathal Crowe, and Independent TD for Clare, Michael McNamara. Good morning to you.
Good morning.
As we say, we did hope to get the senior TDs here to speak to us today. But from your point of view, Kieran, we've talked about the chaos all morning here. We've been hearing about this for years in UHL. Have the government failed the people of the Midwest?
No, I don't think so. We've put huge amount of resources, and that came across in the programme this morning, into UHL, 108 additional beds. The budget has gone up by 100 million in the last 4 years. We've seen 1,100 extra staff.
But it's gone up by 100 million in the last 4 years. There's an extra 1,000 staff in 4 years, and the overcrowding and people on trolleys is going up and up and up.
In addition, so there is still a bed capacity issue here. So if you look at other Model 4 hospitals nationally, we're roughly about 14% behind. So there's about 82 beds that we need at the moment, minimum. We're putting 86 beds into UHL this year alone. There's, in addition to that, a 96 bed block under construction. It'll be ready in 2025. So 2025.
So my question was, have they failed the people in the Midwest? And you've just said yes.
No,
that you're well behind.
No, we've put in a huge amount of resources, but we accept there's still a bed capacity issue. But if I can put in context, Tommy, with all the resources we've put in, we have to question why in the first quarter of this year that we've seen an increase in ED admissions, more or less the same in Limerick as elsewhere in the country, and yet we find that our trolley count is up 49%, nearly 50%, whereas elsewhere in the country is down 17%.
Why do you think it is?
I think it's a multitude of factors. Certainly a bed capacity issue is still a factor for us, and that's why we're putting in the 86 beds this year, and we've the further 96 coming on. But I think one of the issues that we have to ask, we need to see reforms very much in the area of having senior decision makers on the floor at all times, and that came across. Stephen Donnelly was in UHL a short time ago. I was with him, and that came across loud and clear.
But this is interesting, because how are you going to staff these beds? Cathal, you're from Fianna Fáil. Stephen Donnelly is from your party. He is the Minister for Health, and he has spent 22.8 billion is our health budget here in Ireland, and still we don't have the average number of beds that we need across Europe. What is going on? Because we don't have enough staff, and overcrowding is going up and up and up.
Yeah, there's a colossal amount of money has gone into UHL and health services overall. But just go back a small bit. The 2009 decision to bring about a centre of excellence, which never materialised, was woeful. It was a terrible decision. It haunts this region every day since.
This is to close Ennis, the emergency department in Ennis,
Nina and St John's were wound back down. And we've paid the price every day since, because the mooted centre of excellence never materialised. I just want to talk about, Kieran has rightly said the beds, but if you just talk about the population here for a moment, and you'll be familiar with this because you're born and bred of this region, 500,000 people here in the Midwest, 24-hour A&E. Dublin, 1 million people, 8 accident and emergency departments. We're funneling too many people to one hospital system.
So and I think is this, if it's not the government's fault, is it the HSE's fault? And then you have to point the finger at the Secretary-General of Health, Robert Watt. His wage has now been increased to €326,000 a year, the highest paid civil servant in the country. Why is he getting job increase or pay increases whenever we're seeing things like this?
Well, there's a new man leading up the HSE, Bernard Glasser, and I would say he's doing a good job, along with Stephen Donnelly. Robert Watt
you think isn't? Is his job?
I'm not going to comment on Robert Washer this morning, and
because it's the civil servants really who are running this, is it?
Yes and no, but I just think as well the hospital management that Kieran has referenced, the senior management for HSE in this region are based in an industrial estate 2 kilometres away from the hospital environment. You need to be on site. You need to have full oversight of the acute operations in the hospital. That is absolutely essential.
The management isn't even on site. They're not even seeing the trolley crisis.
There are managers on site in the hospital, but the executive of the UHL hospital group are in an office building 2 kilometres away. They need to be on site.
You're on the Oireachtas Health Committee. You're in government, and you were saying it's a disastrous decision in 2009 to close the emergency departments in 3 hospitals around Limerick.
Yes, absolutely.
You're saying it's a disaster.
Yes.
But you're in government. Can you not change this? Why can't you change this? Why can't you get people on side?
And may I just, because it's very important that I mention this, I met with Bernard Glasser and I've had 2 meetings quite recently with Stephen Donnelly specifically on this. I believe to address the wrong of 2009, you need to build capacity in UHL, but crucially beyond it. So I'm advocating for an upgrading of Ennis Hospital. I want to be clear to people, I don't want to mislead anyone. You can't wave a magic wand and just say we're going to reopen accident emergency all over again, but you can build capacity. And we've an agreement in the past week that there will now be a working group to look at Ennis General Hospital. How can we beef up capacity? I'd love to see it become a teaching hospital, because
but do you want to see it reopen as an emergency department?
I absolutely aspire to that. Maybe not everyone in government might agree with that, but that's certainly my view. It's one I've represented. I've been a TD for 4 years, and every day I've been there, I sought a position on the Oireachtas Health Committee so I could go right into the depths of this and try somehow. I can't magic up things, but
you were on a trolley yourself.
I was on a trolley. New Year's Eve, my appendix was rumbling, it nearly burst, and I spent 2.5 days in a trolley in UHL in early January. I got fantastic care by nurses and doctors, but I could also see the limitations. I saw a huge amount of overworked nurses, and I didn't catch the very early parts of this programme, but I hope you'd some of the frontline workers, because they are flat out. There's a lot more of them in the last 4 years. There's an extra 1,100.
We were speaking to them.
But they're the real heroes of this.
But if we've got, and that's one thing, there's messages coming in saying this must be very negative for people who are working in hospitals, hearing all this. But we've had the frontline workers in here this morning, an emergency consultant and an IMO nurse representative who was like, no, we want to be here talking about these issues. Michael, you're an independent TD from Clare. We've had people from Clare sitting here this morning that are like, it takes me 2 hours to get into UHL in order to get treatment. No one wants to go there. We're afraid of going there. What is what's happening? Obviously, what's happening in UHL is a disaster. Do you agree?
No, it is. I mean, the health service across the country is under pressure, but it's under particular pressure in UHL. I mean, it is by far the worst hospital consistently. It is something that needs to be remedied.
What is that remedy? Because we're talking about this in government and nothing's ever happened.
Consistent governments going right back to the 1980s have underfunded the Midwest as regards healthcare provision. That can't be sorted out overnight, but it can be sorted out. But that underfunding continues right up to the most recent spending review in 2022 that was published about a month ago by government. So, I mean, there is a historical underfunding. It needs to be addressed, but it is unfortunately taking time. Unfortunately, I also think there's a problem with management of existing resources. I mean, I accept that we're asking management to do a loaves and fishes job, and that's impossible. I mean, they can't work a miracle. But on the other hand, there was a lot of criticism of management in the HICWA report of June 2022 into the unannounced visit, which found that the level of overcrowding posed a risk to patient safety. Now, when that risk to patient safety results in a young girl dying without adequate treatment, that is a national disgrace.
Yes.
When we find out that a man from the same town died 3 years previously and rigor mortis had set in before he was seen, that is a disgrace. And that is the only... I mean, I accept that health is a problem across the state, and every TD from every part of the country is talking about health. But there's a particular problem here, and it needs to be taken in. The Taoiseach has a very limited amount of time available to him. There's a very limited number of problems that he could actually sort out. I wrote to him, I asked him to take reform of the HSE into the Taoiseach's department, to sort it out quickly, to do what needs to be done, to
but listen,
make it
we
the best
know
hospital
that Simon Harris
has
promised before, when we talk about scoliosis and not having to wait over 12 months for treatment. He has been the Minister for Health. He has seen this. But we had Marie McMahon. You just mentioned the young girl who passed away. We had Marie McMahon.
Aoife Johnson and also Martin Abbott, both from Shannon.
Her husband died on a trolley at 11 o'clock at night. He wasn't found until 4 o'clock in the morning. She received a phone call.
He was alone.
He died on his own. He died alone on a trolley, backed up, head to toe. That's not the level of healthcare we want to provide, your government want to provide, is it?
That's unacceptable. And, you know, once again, it's his anniversary, he's passing, so there is no excuse. I think the immediate issue here is we must bring down the numbers of people on trolleys. And this is a very important point for me, and this has dominated my political life here. And I have fought and campaigned with others to get extra resources into the hospital, got the 16 modular block built with the 96. The resources, there's 20 million being given to UHL now on top. That the medical
45% budget.
More immediate measures.
Massive.
More immediate measures.
But where's it going?
The medical assessment units will now be open until 12 o'clock. We've spoken about the 86 beds. We need to see the improvements. There's a director now being put in terms of patient flow. We need to see the decision makers on the ground, the senior consultants, so that decisions can be made and discharges can be made in time.
You're talking about beds. Beds all need to be staffed.
Yes.
And they need to be staffed by quite a number of people. We don't have safe staffing levels in countries around the hospital. There is a private hospital opening in Limerick. The Bonds is opening on the Ballysimon Road. When that comes, people think there's going to be an exodus from University Hospital Limerick because staff do not want to work out there, and why wouldn't they work in a lovely private hospital? How are you going to staff those beds when the private hospital opens?
I heard Professor Watt on earlier, and there's been a relatively low take-up on the new public contracts for consultants.
Yes, very low.
But he did say that 40% of the consultants in DD taken up the public contract.
But also we can't get nurses. We can't keep nurses in Limerick.
But it is fair to say that if you look at, we'll say, in the last number of years, well over 700 of medics between nurses and consultants have been taken on board in UHL. We continue to recruit, and in terms of resources...
We've got a private hospital, two possible private hospitals coming on board in this area. Why would they stay in the public system?
No, the more immediate thing here is, over the next number of months, the 105 people on trolleys yesterday in UHL. That's unacceptable. The resources have been put in. We expect to see, on behalf of the people of Limerick and the region that we represent, that those trolley numbers will start to...
Carl, you're on the Oireachtas Health Committee. I'm flabbergasted to think that the management site for UHL isn't even on site. The computer, there's no integrated computer system within the HSE as well. It is archaic. If you want to go from one hospital to another, you have to carry
There's more about your car. Your NCT tells more about your car than your health. There's no mobile record that follows.
You're a politician. You're the one who's involved in it.
Just a few things to come in on there. First of all, we've an incredible university out the road. Went there myself. I was in college with your weatherman Derek. But there's incredible nursing graduates coming through there every year, and it's devastating to see that photo during COVID.
Half of them are leaving to go to Australia and Dubai.
Finish my point. That photo during COVID of 60 or 70 doctors and nurses weren't on the beach in Melbourne. I've spoken with Stephen Donnelly and the Nursing United. We need to bring in a criteria where perhaps in their final year of training there's a bursary for those who will remain here. I think it has to be more carrot than stick, but we have to turn that back. If you're graduating from medicine or nursing, you have to give service here. It makes no sense.
You think it should be obligatory, compulsory to have to give?
It makes no sense to have
how many years do you think they should have to give?
I think there should be 3 or 4 years. Compulsory. And every person who goes through the Irish college system, education is funded by the taxpayer. We should have some bursary. Now, we need to deal with accommodation for nurses as well, because it is nigh impossible for them to work, certainly in the city environments. But that needs to be dealt with. There will be a digitalisation of patient records, by the way, because it is absolutely woeful at the moment.
But who was in charge? The whistleblower had to leave.
But I think blaming young people because they want to go abroad and work in a properly managed health system is not going to work. Penalising them for going abroad just means they'll stay abroad for a lot longer. I mean, that was something that governments have looked at. So I must say I don't agree with that approach. What we do need to do is to make it a system that they want to work in, because there are many reasons to go to Australia around the weather, particularly this spring, but people want to be close to their families, people want to be close to their friends and their networks, and they're going abroad because they don't want to work in a chaotic system where I have been in that A&E, as Cathal as everybody has. It's chaotic, and at the end of the day the nurses know that when it goes wrong, and it does go wrong, it inevitably goes wrong very often when it's as overcrowded as it is, they're the ones who are going to carry the can, they're the ones who are going to be blamed in reports and hauled over the coals, and they're the ones who are going to have to face a grieving family and say the system let you down. and it's not. You know, we can continue like this. Simon Harris makes a lot of promises. He makes more promises than any other politician in the history of Ireland. He's a former Minister for Health.
Yeah.
He's a Minister for Health in the lifetime of this government. I would ask him, and I thank you very much for having this programme here this morning, for giving the people of the Midwest an opportunity to just explain that we're not second-class citizens.
Well, they seem
we're not looking for a perfect
frustrated.
we're not looking for a perfect healthcare system.
Angry.
We're just looking for the same level of healthcare as every other part of the country. We talk about Irish independence, the struggle for independence. It was fought on the banks of this river, and we deserve the same level of a hospital. Nothing special, just the same. But he has an opportunity. He does have an opportunity.
I know.
Listen, Mike McNamara from Clare Independent TD, Kieran O'Connell, Fine Gael, and Cathal Crowe, Fianna Fáil. Thank you all for joining us this morning.
Thank you very much.
Get in touch with us. 0896 111 111.
You're very welcome back. Swifties are up to 90 on high alert ahead of the pop megastar's new album, which is called The Tortured Poets Department, and it's out tomorrow.
Yeah, just to add to her billion that she already has. Yeah, stylist Mandy Maher is travelling back in time to pull some style inspo for Taylor Swift's
and that's for sure travelling back in
most fashionable eras. Good morning to you,
Good morning to you both.
How are you? Okay, so we're going to start with Katie, and this is the Reputation team.
That's right, and this is really bang on. I'm really excited showing this look this morning from the Reputation team.
Let's have a look at some of the... This is like some of the style that she wore.
These are some of the styles. These are the inspirations that we're looking at this morning, and you'll see exactly what we're looking at here with the Reputation. We're starting off firstly with what we're showing is the jacket first, because I wanted to put a jacket with it. If we're going to concert, we need to be some little bit warm, considering the dress is quite short.
Sure. But this is very Taylor Swift.
And it is completely very Taylor Swift. So the jacket itself is from Friday's edit. It's a single-breasted jacket, and of course we know ourselves with blazers. Gràinne, we know ourselves, we love them. I think they always look sharp. And I went for a slightly oversized blazer, even though we wore it on the shoulders this morning because of a styling. But it works really well.
And then the dress, it's all about the dress.
To be honest with you, the dress is a major talking point, and I'm super excited to introduce this label this morning. It's called Clinched by Chloe. Chloe Walsh, a girl from Limerick, and I'm absolutely delighted because this is a brand new collection that she has, and it's a real Taylor Swift theme, isn't it fabulous?
Is it cinched or clinched?
It's actually cinched.
Yeah.
So what it is, there's actually paddings in the inserted in the waistline to actually cinch in your waist. Isn't that the most clever design
ever? We love that.
I love it too, and it really works.
What did you say?
There's actually an insert in the waistline of the actual dress itself to actually cinch in the waist, and hence the reason cinch.
Cinched by Chloe.
Cinched by Chloe, so lots to choose
Gorgeous
from.
bust
She's
line on it
online,
as well.
but I love it. And it's very Taylor Swift theme, isn't it?
Very much so.
Yeah, I love it. Really, really cool.
Bit of glitter.
And the earrings are gorgeous too.
And exactly, we just teamed up then with these great little earrings. All of our jewellery this morning is from Burke by Design. They're in Clonakilty in Cork. And again, like that, they're light, they're funky, they work perfectly with the outfit. Because of the sequence dress, you don't want to go too much overboard either. And we see even the back of that dress as well. Isn't it really beautiful?
That would be absolutely fabulous now on Taylor Swift.
Oh, yeah. No, I'm telling you, I tell you, Cinched by Chloe should be getting out there now to Taylor Swift.
Now, Sophie's here, and this is the red theme.
This is the red theme.
This is when she was wearing lots of red.
Absolutely. And these are all of her looks this morning are based on her albums, of course, and her tours that she's done over the years. And again, like that, it's what do we incorporate? Loving this dress. Is this a real showstopper?
And this is cinched by Chloe as well, is it?
And this is cinched by Chloe. The same impact with it. The inserts are in the waistline, but again, like that, it's
They're very good prices for what they are, aren't they? Because when you see dress like that, you think, oh, that's going to cost a lot of money.
And it
see this now, the Style Awards, VIP
I just want to say, and we were talking
about
that backstage. Wouldn't it be fabulous for an awards ceremony evening, or even Jebs or anything like that? It really, really is beautiful.
And it's giving Jessica Rabbit. It's real bombshell.
It does,
Hollywood.
and I'm actually saying that itself by Sophie this morning. I even think Sophie looks very like Taylor Swift even this morning.
Absolutely.
Again, seeing that gorgeous lacy going on in the back then as well.
And you just have a little bag with it there?
And then we teamed it up then with the bag, and the bag itself is again from Burke by Design in Clonakilty in Cork. And again, we kind of just kept the red together. Do you know, sometimes with styling, people are afraid to kind of keep the colours the same, but it works.
It does work.
The red on red
does work.
Absolutely.
Lovely.
And then the gold with the shoes.
And
lovely.
These shoes are loady. I love these. These are Sabato in Adair, a beautiful shoe boutique.
An amazing shoe boutique.
It's unbelievable, isn't it?
It really is. And Lodi are so comfy.
Aren't they? Unbelievable. There's great padding in the inserts of those heels as well. And they're not too high either, so they're very wearable.
And then the earrings?
And then the
lovely.
earrings then, Burke by Design again. And again, we kept it the red theme as well with the earring on that as well, with the little hoops. Works really
You
well.
just turn your head slightly just so we see it. Yeah, look at it
so you
there.
can see it. Isn't it gorgeous, isn't it?
Yeah,
And
really
it really is,
effective.
again, it's beautiful. As I said, keep it quite simple when it comes to accessories because the dress really is the wow piece in this. And that's what you don't want to overtake from that either. Of
course.
Very nice. Thank you very much, Sophie. That's lovely. Now, we're going with the folklore theme.
Yeah, so we're heading now with the folklore team. And this folklore really with Taylor Swift is all about the boho vibe. It's all about the loose fittings that really kind of like just go with the flow kind of styling. And that's what I love about what we're going to show right now.
This brand I love. I wear a fair bit of it.
It's unbelievable.
Yes.
And it's really forgiving as well if you want to wear something just loose and very, very comfortable.
Yes, I discovered it when I was making Gràinne and Straw last year because it's summer, it's the beach, it's that vibe. It's
fabulous. I love it. This is from Lady Penelope in Adair and it's absolutely beautiful. I loved it when I saw it and said, okay, this is really going to work with the boho vibe. It has that denim effect along with the satin dress. It's loose, it's comfortable, it has the pockets. But I'm loving all the summer vibes going on with the shell print and the stars. I think it'd be a great summer piece as well for
and you
holidays.
could wear it open as well as a duster coat kind of thing.
You sure could. Like, you know, you could off you go.
Yeah, or belt it
perfect,
or whatever.
And belt it whatever way you want. Now, it is the loose look, which I do like, because I think, I just think the loose works really, really well with this.
And the boots?
But the boots are a major talking point. I'm loving these. Again, in Lady Penelope in Adair, they're the cowboy boots, which is what Taylor Swift is all about, is the cowboy theme. But I'm loving these, and they're in the suede, beautiful blue. Works perfectly, of course, with the denim on top.
I love that.
It's nice, isn't it?
They're great boots.
I know, and they're so comfy.
I betcha.
Yeah, absolutely. Really, really beautiful.
And then jewellery.
And our jewellery then is Burke by Design. We went with these simple earrings and stars. Kept it quite, as I said, quite simple, but I'm loving them. And they're light. I think that's very important when it wears earrings. You want to make sure there's something very comfortable, not too heavy.
Yes. The choker and bracelet are
and the chokers,
similar,
they are indeed, Alan. Yeah, well picked up their matching bracelet and choker. And again, like that, we did keep with Taylor Swift team. She's great for the chokers. And I'm loving the fact you can kind of slightly see the blue vibe picking up with the denim as well.
It's like sea glass.
Isn't it?
Yeah,
yeah.
Really beautiful.
So it really works well. So that's, yeah, it's just giving the whole look this morning. What's coming in for fashion? This is what's going to be seen going through.
You have your finger on the pulse, man. You're all over it.
Don't mind that. I had the girls filling me in about Taylor Swift. The cars driving
You'll
them
be
nuts.
first on to buy the album tomorrow.
I will, of course. I will.
Mandy, thanks so much
thank
for
you
that.
both so much. Thank you.
Now, after the break, we're going to be taking a look at the movies here with Brian Lloyd.
But Tommy and Muireann have been in Limerick all morning discussing the terrible overcrowding crisis in University Hospital Limerick. What's still to come?
Yes, thank you very much, guys. Yes, we've heard from the politicians, we've heard from staff working on the ground here in University Hospital Limerick, but coming up after the break, we're going to be hearing from the viewers.
Yeah, and in the background, you can just see Limerick Maternity Hospital right there. And of course, Thomond Park in the background as well. Good memories there. We're going to be taking your comments on University Hospital Limerick. That's coming up very shortly on Ireland AM. Hello, welcome back to us here in Limerick. All morning we have been talking about the Irish healthcare system, not just here in Limerick, and we know that the situation here is dire, but around the country. It's for a very rich country who spent 22.8 billion on our healthcare system. We're not getting the service that we deserve.
It is a frightening amount of money. Where is it going? We don't know, because some of the messages that are coming through, people just tearing their hair out. I live in Tipperary. I was in a trolley in UHL for 3 days. I was not given a diagnosis. I was sent home in the middle of the night. I will not go back to that hospital again.
A message saying some of the stories are dreadful about UHL, but I have to come out in their defence. I've been there twice this year and they're fantastic. It's not the doctors and nurses that are the problem. They were amazing to me, and that's what we've been saying all morning. We had a consultant here. We also had a nurse here who wanted to talk about the issues and the situation in UHL because they are doing their absolute best, but they need help.
I took my mum to UHL in February. A&E was absolutely so overcrowded. My mum was then asked to move to a chair despite the fact that she was in extreme pain, vomiting and fever. Some of the stories are dreadful about UHL, but I have to come out in their defence.
Yeah.
Yeah,
we just did that one, and we're going to get to more of those texts in just a bit. But for now, Gràinne and Alan, it is back to you in studio.
Thanks very much,
Thanks,
Muireann.
guys.
Just shocking stories
It
there.
really
Imagine
is.
just knowing that if you lived in Limerick, that you don't want to go to the hospital.
No.
It's just absolutely.
That you're going to avoid the hospital, which will cause problems as well.
Of course it will.
People will go too late for attention.
Yeah. It
really is
horrific.
frightening.
It really is.
From what is a horror story in Limerick, really, we're going to move to a different type of horror now, and that's horror flicks, and starring a rising Irish actress in a true story thriller as well that has got the internet talking.
Yes, here to tell us on what to watch and what to dodge is Brian Lloyd from entertainment.ie. Good morning to you, Brian. And we are going to start with Abigail.
Yeah.
So tell us about this.
Yeah, so this is the new film starring Alicia Weir. People would remember her from Matilda, the musical.
Great little actress.
Yeah, great little actress. I think she was on the show.
She was on the show,
That's right, yeah. So essentially what's going on is Dan Stevens leads, who people will know from Downton Abbey. He's in The Guest, a great actor. He leads this group of criminals that kidnap her from this crime boss, take her to this abandoned mansion. They're going to ransom her for 24 hours and then get a load of money out of it. But then it turns out that the little girl is in fact a 200-year-old vampire that is slowly killing them.
My
one
God,
by
look
one.
at Alicia there.
Yeah.
I mean, is she good in it?
She's brilliant in it. This is the thing. Like, I mean, the film is like 16s, I think, or something like that. So it's really quite extreme, and she really does. Like, I mean, by the end of the film, like she's like literally covered in fake blood and like has killed like nearly half of them and stuff like that.
And it looks like she's being very physical in this role.
Absolutely, yeah. Like she is literally like diving onto people. Half the film is just the shock of that visual, like she, with the full tutu, like literally like ripping people's throats out and stuff. I enjoy it. Like it's pretty full on, I will say. It does a little kind of. It overplays its hand a little bit, I think. It's in like they're all kind of turning on each other and what have you. But and it's like 20 minutes too long, I think.
Right.
Like, so.
Why did they do that?
And that's the thing, isn't it? Like, I mean, if this film was like 90 minutes and there was a much more pacing, but a bit tighter, it'd be a far better film. As it is, 2.5 out of 5.
2.5 out of 5. Okay, telly at the weekend when we love a good Saturday night.
Ah, yeah.
And you can't beat it on a Saturday night. Sit down and Britain's Got Talent's back, and we're going to be showing it here on Virgin Media 1.
Yeah, so it starts back at 7:30 on Saturday. This is the 17th season of it now. Already there's talk about they broke some record for the most amount of golden buzzers this time around. Amanda Holden seemingly hit the thing twice. There's talk as well that...
This year?
This year, yeah.
She did that deliberately because what's his name did it last year.
Bruno
did it by accident because he said he did. Oh, I didn't think you could only do it once.
Yeah, probably.
Because nobody explained the rules to him.
Yeah, nobody explained the rules.
Sure. Yeah. Yeah. So seemingly this time around, there's apparently going to be an AI act. Apparently people have been talking about as well. I don't task AI. I don't know. There was a singer as well. Apparently that's like a young Adele or something like that. It's doing a lot of. But yeah, I mean, look, it's Britain's Got Talent. Ant and Decker back hosting as well. They've actually said now that they're putting Saturday Night Takeaway on hiatus.
Yeah, that was the last one last week.
Because they want to focus on Britain's Got Talent. So
and Simon's been saying this thing is going to run and run and run.
So 7:30 Virgin Media 1 Saturday. Can't wait. I'll be watching it. I love it. Do you know what? It's perfect Saturday night, Father.
Exactly.
A lot of. Would you say there's a lot of controversy, but a lot of talk about this film, Baby Reindeer?
So a sweet story about Christmas.
Yeah, just so sweet, just so nice. No, not at all. So it's a 7-part series. Sorry, 7-part series on Netflix. It's based on the true life story of Richard Gadd, who was this rising comedian, was working in a pub in London, and a woman came in who seemed visibly upset and was crying, gave her a cup of tea and kind of befriended her, and then it turns out that she was actually a violent stalker who had stalked numerous people and had now fixated on him. So it goes through basically the terror of that, what that kind of involved, and then it goes into his own personal life, that he had problems with drug abuse, that he was groomed and sexually assaulted.
Sounds quite dark.
Very,
a bit
very
like
dark.
You, maybe.
No,
vibes.
way more than You. Like
really?
You was like... is like cheesy crap, let's be honest about it. Like, it's fine or whatever.
This is very heavy watching.
This is this is based on a true story as well. Like, he did a one-man show at the Edinburgh Fringe, and it was all based on what this is all about.
I did see a clip of this, actually. And this lady, when she arrives and meets him first, she comes across as very ordinary woman.
Yeah. She does, yeah. She seems completely like normal and all the rest of it, but then of course it spirals out, and you find out about her history and all the rest of it. So
what are you giving it?
Like 4 out of 5.
Oh, really?
It's really worth it.
If it's that your cup of tea, you'll really enjoy it.
100%.
Okay, Brian, as always, thank you so much for that.
Thank you.
That's all from us here in studio this morning, but let's head back down now for a final time to Muireann and Tommy in Limerick. Over to you guys.
Hey, thank you very much. Yes, we are still here in Limerick, and just another text message. University Hospital Limerick is like a war zone. It's disgraceful. There is no dignity in that department, and it cannot be allowed to continue.
The HSE's main problem is they don't have enough staff. This will just continue as we lose all our newly trained nurses and doctors to emigration. They don't look after their staff. My daughter is a third-year student nurse. We pay full college fees, and in one hospital, she had to pay €49 a week for parking whilst working a 39-hour shift for free.
We get text messages every day on this show. We love hearing from viewers on Ireland Day and from all over the country, but it was amazing to get down here to Limerick, to talk to people who are on the ground, to hear from people who've had to deal with the terrible services, the terrible overcrowding, trolley issues. Heard from doctors,
the people who have to
from
work
nurses.
within the system as well.
And sometimes it's just amazing to get down to towns, villages and cities to actually really hear from the people who live in that area. So it's been amazing to be here in your lovely Limerick.
In gorgeous, lovely Limerick, a place I love so much. But we all know that there are elections coming up. We have got local elections, we have got European elections, and we are all waiting for that general election to be called. There are real issues in Ireland, in everything from healthcare to housing, and we all know immigration is coming up. They all seem to be connected. And do you think we've got the politicians who are doing the right job for us? Certainly from what we heard this morning. We were talking to a woman whose husband's 6th anniversary is today, and he died by himself in a trolley in University Hospital Limerick. We need to do something.
The money's out there, they're doing everything they can, or so they tell us, but with the messages we've received, maybe not. So listen, thank you so much for joining us here in Limerick. To Alan and Gràinne back in studio. We'll see you back here
tomorrow
next
morning.
week.
Oh yeah, we're back next week. Tomorrow morning though, Ireland Day, and we'll be live from 7. We'll talk to you soon. Thank you very much.